Hello, we're here today to talk about concerns our patients have about COVID vaccination for women wanting to get pregnant and for women in early pregnancy. My name's Kate Stern. I'm an Associate Professor of Obstetrics and Gynecology at the University of Melbourne and the Royal Women's Hospital, and I'm a Senior Fertility Specialist at Melbourne IVF.
So my name's Michelle Giles and I'm an infectious disease physician and immunisation expert. I'm a professor in the Department of Obstetrics and Gynecology at Monash University and also with the Doherty Institute. I'm also an infectious disease physician at the Royal Women's Hospital.
Thank you so much for coming, because many of our patients have so many concerns about COVID vaccination and about trying to get pregnant and early pregnancy. Firstly, so many of our patients say, I'm so scared about the vaccine. How does the vaccine work? Can you help us with that?
I get the same questions as well. So I think it's really important for patients who have these concerns to actually understand how the vaccine works, because once you understand how the vaccine works, I think it addresses many of those concerns. So the mRNA vaccines are the ones that I will explain, because that's the one that is really recommended, particularly in men and women of the age group that you've probably seen as patients. The mRNA, what the M stands for is messenger. And so what it really is a set of instructions. So it's a set of instructions that is delivered to the muscles of your arm when you get the intramuscular injection. And what some people think is that the vaccine somehow travels around their whole body, but that's actually not true. So what actually happens is the cells in the arm, the mRNA, the messenger RNA, goes into those cells and it encodes for a thing called the spike protein. The spike protein is a part of the COVID virus that is important for it to cause disease. So you're not actually getting the whole virus. The vaccine does not contain COVID, but it really sends this set of instructions to your cell so you make that protein. And then it's destroyed. So the mRNA is broken down. It's not incorporated into your cell. It's not changed into DNA, and it doesn't travel around your whole body. And that's relevant for fertility, of course, because I think a lot of people have concerns that it might affect their ovaries. If you're a male, it may affect your sperm, or it may affect your baby if you're pregnant. But we know that the vaccine's actually broken down in those muscle cells, and the spike protein that's made then stimulates your immune system. So your immune system recognises that spike protein and makes antibodies. And those antibodies are what's crucial to protect you if you get exposed or come into contact with coronavirus in the future.
It's very important, I think, for our community and our patients to understand how coronavirus affects pregnancy.
Absolutely. Part of what I do at the Royal Women's Hospital and at other hospitals is look after pregnant women and pregnant women with infectious diseases. And what we are seeing today is that pregnant women are getting admitted to hospital who get infected with coronavirus. So a lot of people hear that for the majority of the population, particularly younger people, coronavirus only causes a mild illness. But in fact, in pregnancy, we see that it can cause a much more severe illness. And what I mean by severe is that we know that pregnant women who get COVID are much more likely to be admitted to hospital, much more likely to be admitted to the intensive care unit, much more likely to need ventilation, so to have a tube down their throat to help them breathe. And because they're so sick, actually, more likely to have a baby born prematurely. So even that may be to help support the woman who's really sick, or it may be because of the infection itself. So women who are pregnant with COVID get a lot sicker than women who are pregnant and don't have COVID, or women who are not pregnant of the same age. So the only thing we have, the only tool that we really have to protect women from getting infected is vaccination. What it's really important to remember is that the disease, COVID disease, is much more dangerous and much greater risk to the baby than the vaccine, which protects them from getting that. So it's important to understand that getting COVID in pregnancy is not usually, it can be a much more severe illness.
Tell me about the COVID vaccine and pregnancy, because this is one of the concerns so many of our patients voice, and I'm sure your patients do. They say, I don't want to have the vaccine because I'm worried about the effect in pregnancy.
I understand why pregnant women are concerned, but there are many things that are important in protecting pregnant women, and vaccination is one of them. We know that other vaccines in pregnancy have proven to be very safe. Influenza and whooping cough vaccine, two examples that protect the mother and protect the baby and are extremely safe in pregnancy. When COVID vaccines were first trialled in clinical trials, pregnant women weren't included in those clinical trials, so we didn't have that information initially, so we weren't really clear about the safety of the vaccine. But that's changed, because once the vaccines were made available, many thousands of pregnant women worldwide have received the vaccines, particularly the mRNA vaccines. And what researchers have done, they've collected that data, and they've been able to reassure us that pregnant women are not more likely to have side effects to the vaccine. We also know that the vaccine actually works, so there is also some studies that have been published that show that it does protect pregnant women. And most importantly, I think for your audience, is that it's been shown to be safe. And what I mean by being safe is that women have been followed throughout pregnancy. So they're women who are vaccinated before they conceive, early in pregnancy, and then second, third trimester. So all trimesters of pregnancy. And then they've been followed to the birth of their baby, and those babies have been checked, and the mothers have been checked, and those outcomes of pregnancy recorded, and there hasn't been any increased risk of adverse pregnancy outcomes. So there's no increased risk of abnormalities in any babies. There's no increased risk of miscarriage if you get it early in pregnancy. There's no increased rate of preterm birth with the vaccine. However, there is, as I mentioned earlier, that rate of preterm birth is increased if you actually get COVID disease. Almost every obstetric society in the world, and including the World Health Organization, the CDC in America, all recommend the COVID vaccine for pregnant women at any stage in pregnancy, and have reassured pregnant women that it's safe.
Tell me about early pregnancy. Our patients are always very concerned because that's such a vulnerable time.
There were more women who'd been vaccinated later in pregnancy, so we did have a small number who were vaccinated earlier in pregnancy, but that's significantly grown. And in fact, there were two publications just this month that have looked at women focusing specifically on that group and the first 20 weeks of pregnancy. So there was a study that's come out of the United States and another study with Norwegian data. And what they looked at is that women who were vaccinated very early, so around the time of conception or in that first trimester, whether they had an increased rate of pregnancy loss in the first 20 weeks. And what both of those studies, so they're different countries and different populations, but both of them did not find an increased rate of pregnancy loss. So we know, the thing that I explain to women, and I'm sure you do as well, that pregnancy loss occurs. It occurred before COVID was here, and it occurred before we had COVID vaccines. So unfortunately, there are some women who will have a pregnancy loss, and that's got nothing to do with the vaccine or the pandemic. One of the most important things you can do is actually get vaccinated to make sure you're protected and you're protecting your future baby by being vaccinated before you get pregnant. But if you are pregnant, to know it's safe as well.
Yeah, that's a very important message, isn't it? To know that now there's a lot of data out there, and we can be really confident saying to our patients, not only is the vaccine safe for you in early or late pregnancy, but it's the best thing you can do for your potential baby and your health. I'm really pleased now that we've got enough data. There are lots of studies.
Yeah, I think the other important point to make is those antibodies that your body makes when you're vaccinated may also protect your baby, because what we know from studies is those antibodies can be found in breast milk and can also cross the placenta. So it's really important the vaccine doesn't go to the placenta, the vaccine doesn't cross the placenta to harm the baby in any way, but actually what we know happens is those antibodies that you make cross the placenta. So your baby who can't be vaccinated with COVID, who's born has antibodies potentially, if you have been vaccinated in pregnancy, that might protect your baby if it gets exposed to COVID. So I think that's another benefit of being vaccinated. Kate, can I ask you a question?
Sure.
As a fertility expert, one of the things I get asked a lot, and I'm not an expert in fertility, but I know that a lot of women worry about whether the vaccine affects the quality of their eggs or the quality of their embryos, and whether in fact they should wait until they've had fertility treatment before getting the vaccine. How do you approach that kind of question?
We now have several studies that have looked specifically at the effect of the vaccine on eggs and sperm. And it's pleasing to be able to now say with confidence that there are no adverse effects on the egg or the egg genetics or our DNA from the vaccine. And so that means the eggs are not going to be adversely affected by the vaccine. And now there are several studies looking at sperm in men who have had vaccination. As you know, COVID itself, the illness, can adversely affect your sperm, and we don't know yet whether that's temporary or permanent. It can affect the sperm count, but the COVID vaccine has been shown not to have any adverse effects on sperm. So I think for patients that are having fertility treatment or patients that are trying to conceive themselves, there is now very reassuring data that having the vaccine will not affect the success of a pregnancy being created, either in the laboratory or spontaneously. So we know now that COVID vaccine will not affect your ability to get pregnant, and it will not affect the health of your embryo in any bad way. Have you had many patients asking you about their periods being disrupted by the vaccine?
Yeah, there's quite a bit of discussion, I think, among the population about their menstrual cycles.
Yes.
And what we've heard and what we've read is that some people feel that after the vaccine, their menstrual cycle has changed, and that any change in the body, I think people find concerning and worry about what that might mean, whether that's got any long-term implications or whether that may impact on their fertility. It's possible that the vaccine can affect your immune system in a way that impacts on the hormones in your body, but that is likely to be a temporary impact. It's like the side effects that we expect after the vaccine are usually short-lived. They're only for a few days. It's a temporary thing. So if there is any association, it's likely to be temporary, but I think it's important that, we're taking it seriously, and there are lots of groups around the world, including, I think, your group here in Melbourne, who are making sure that we're investigating that and looking at the data, collecting more data so we can better understand it.
It's like any other response to a vaccine. Your body is making antibodies in response to that vaccine, but we know that it doesn't affect the health of the uterus. It doesn't affect the health of the lining of the uterus, and so it's not going to have any impact on trying to get pregnant. But it's important that women understand that there could be some effects and are not alarmed by that. We really understand that our patients want the best information before they make a decision about having a vaccine when they're wanting to get pregnant or in early pregnancy. So we respect that, and the most important thing is that our patients can get accurate, scientifically validated information. We know that COVID is bad for pregnancy and it's bad for your baby. We know now there is a lot of evidence that COVID vaccine is safe for women wanting to get pregnant, and it's safe for women in early pregnancy. We know from good evidence now that there are no bad effects of the vaccine on eggs. There are no bad effects of the vaccine on sperm. We know from the available evidence that there is no negative impact of the vaccine on early pregnancy, and there is no increased risk of miscarriage from the vaccine. We know that the vaccine may be associated with slight menstrual change for 1 or 2 cycles, and that's okay as long as we know that. But we know it is so important for women wanting to get pregnant that they access accurate information and ask me about safety. It's so important. And we can't just tell our patients, have the vaccine. Our patients need to be empowered to be able to see the data and make a decision.
I think it's really important for people to understand that COVID can be a really serious disease in pregnancy. That the vaccine is the best way of protecting yourself and your family from COVID. The vaccine works in pregnant women. It's safe in pregnant women. In my daily life, in my work, I'm seeing my patients being admitted to hospital. We have pregnant women in every maternity hospital in Melbourne today, some in ICU and some not yet in ICU but really sick on the wards. And if I can prevent that happening in anyone, that's what I want to do. That's why I'm here. A lot of what I've said may be interpreted as quite scary, and especially the information about how sick pregnant women can get. And I think that's why I feel so strongly about vaccination, because I know it can protect them. And what we are all about, what we want is women to have a healthy pregnancy with a great outcome. It's one of the most joyous times of your entire life. And that's what we want pregnant women to experience. And that's why we're here talking about vaccines today.
Michelle, thank you so much for coming today. It's so important that we can help our patients get the best information to make the right decision for their pregnancy and for their baby and for their fertility. So thank you so much. I'm so grateful. You have such a wealth of experience and you are really the best expert in this area. Thank you.